So let's talk about earlobe repairs. There's two types. The first is where somebody has a split earlobe. So the earring tore through over time, can be for a couple of different reasons, but what I do is I repair it. I take out that cut and I actually do a little flap repair so it's less likely to tear in the future. The other kind of earlobe repairs we do are for people whose earlobe piercing has just gotten larger. Often those patients say, every once in a while my earrings fall out, or over time my earring, instead of sticking straight out, has kind of started to fall down, and so if they're wearing something that's round, maybe it's pointed more towards the floor. That one, I cut out those little edge and I close it. Both surgeries get a couple of tiny little stitches that we take out about 5 days later. The recovery from both of those is almost nothing. Most patients don't even realize that we've done the surgery later on in the day. They don't need any pain medicine, they don't need to do anything about it. Now, after all this is done, usually at about the 2-month point, I re-pierce your ears with your earring. Now that's important because I'm gonna do it in a spot that's less likely to tear again in the future, and by using your earring, if we do one side, you can wear a normal earring in the other side instead of having one of those little gun-piercing earrings in your ear for 8 weeks. So really easy, done in the office, we do it all the time.